India. A very good evening to you, Dr. Nevine. Thank you for joining us.
Good evening.
Always a pleasure to have you with us, Dr. Nevine.
Thank you.
Allow us, along with our dear viewers, to watch a report on the role of AI in the healthcare business and the healthcare system. We know that AI can have a lot of important roles to play, like the accurate cancer diagnosis, the treatment of rare diseases, the development of new medicine, the automation of redundant healthcare tasks, the robot-assisted surgery, and much, much more. So let's watch a report on this and come back and start our discussion and focus also on healthcare economics with the help of AI.
The government is following up on the telemedicine remote medical diagnosis initiative, in which patients are diagnosed by physicians at any time and place with the assistance of a series of technological applications and gadgets. The initiative provides medications on tests and application coordination between the ministries of health and communication. The move is a strategy towards a transformation that sees the digital transformation and automating services. The health said patients can consult doctors that at any time and place through the applications in the presence of a mediator or a physician at an equipped medical diagnosis unit. Egypt started the first phase of the distance diagnosis initiative in September 2021 with a capacity of 150 medical units. The country plans to establish a total of 300 units nationwide. The university hospital system, which is 120 university hospitals nationwide, is taking part in the initiative, noting that his ministry is also cooperating with the communication ministry to e-link all university hospitals together to automate their medical services. The initiative will contribute to improving the quality of healthcare services, especially in remote areas, capitalizing on technological solutions and treatment that will save the patients in these areas the inconvenience of travel to major hospitals. The health minister called for intensifying the training programs for all the medical staff working at the newly established units. As part of the digital transformation strategy, the Egyptian President, Abdel Fattah al-Sisi, inaugurated the July Digital Egypt platform, which comprises over 130 government-related e-services. With a population of reportedly 100 million in Egypt, is making several key investments in the area of health technology to reduce costs and provide efficient care to its people. COVID-19 has further accelerated digital transformation in the country with the increased use of remote monitoring, telehealth platforms, and artificial intelligence-enabled apps and devices. Moreover, Egypt aims to have 7.7% of the GDP derived from AI by 2030, according to the PwC report titled The Potential Impact of AI in the Middle East. The country has also developed a national AI strategy to integrate the technology in different sectors, including healthcare. The Egyptian government is driving digitization across sectors and has been pushing for universal healthcare and cross-industry collaborations. This is evidenced in the recent partnership announced with the British telecom operator, backing of the UK Department for International Trade, to help Egypt develop a new health insurance IT system on the lines of the UK's National Health Service, NHS.
Riham Morsi and Rasha Abdul Hamid for this report back here in the studio with Dr. Nevine, Makram, Labib. Dr. Nevine, so the role of AI in healthcare has become now one of the main industries that use artificial intelligence. Can you talk to us about the main points, the main areas where AI helps healthcare, with a brief definition for AI itself, simplest definition, if you can, please.
Again, talking about artificial intelligence, we need to mention that we aim to have some machines that can think and take proper or suitable decisions. So we'll try to provide the machine or the system or the software with relevant data. And that's one of the main challenges for us, especially in healthcare.
Sure.
Because healthcare is becoming more data dependent. And whenever we're talking about the proper or suitable decision, then we're talking about proper and suitable and good quality of data.
So one of the important areas is the medical records for patients. So I guess it's clear here where AI can play a role.
Yes, the electronic medical records.
Yes.
Because with AI, we're either trying to transfer knowledge to the machine so that it can take the proper decision, or we're trying to work on a set of analytics, but we're talking about huge amounts of data. And these data are of different types, various types. It's not only data and text, but sometimes, especially in healthcare, we're talking about image. So if we can provide the machine with these data, then it can come with some predictions. And with the predictions, we can be proactive.
And who's filtering out the data? Is it the machine itself, or is it you, the one that gives the input? Because I guess that sorting out the data, and what you always say in your field, like remove the noise or something like that, is very important.
Yes, removing noisy data.
Yeah.
I guess it's both. Because we try to identify the missing values, we try to identify if we have some discrepancies, and then we have some machine techniques. And with the machine learning and with these electronic techniques, we can come up with some solutions for these problems. Because we need, as you just mentioned, to eliminate the noisy data. And by noisy, we're talking about incomplete data, we're talking about inaccurate, incorrect, not updated, and so on.
Or irrelevant, I guess.
Sometimes,
Yeah.
but that's the least of our concern.
Okay. Dr. Nevine, when reading about the role of AI in healthcare, we can see areas like accurate cancer diagnosis, early diagnosis of fatal blood diseases, and so we're talking here about diagnosis being early and accurate. I mean, are we already there? I mean, the medicine world, the medical world, is it already there?
Yes.
Okay.
We're talking here about early detection, if we may say. So we're trying to, again, input some data to the machine, and then trying to come up with some, let's say, predictions of whether this patient may be affected or may have this disease in the long term, not only the short term. And that's what we make use of these days, with early detection not only of cancers, but of several diseases we just saw in the report. And then the second is talking about proper diagnosis. So we're trying to help the medical doctors in what diagnosis, because sometimes they have symptoms that are kind of common between various diseases. So that's the second point. And then we have the prognosis, or we have the prediction. Whether, for example, the patient, if given some medication or some treatment, will be cured or will not really react in a good way to this medicine or to this protocol.
And this is in the form of probabilities, statistics, results, and
It's
percentages
not
and
probability, only it's possibility, because in our discipline, probability relies on the probability theory, which is pure statistics, whereas the possibility relies on the expertise, and here comes the intelligent techniques. So we have kind of a mix, and sometimes we run the software and we try to make use of statistical methods and intelligent methods, and then make a comparison and see which ones are giving more accurate results, if you may say.
So there is a high degree of certainty, you're saying, in
A high degree of uncertainty.
uncertainty.
Yes.
Okay.
And that's why we use the term of possibility, not probability.
Okay.
It's not definite.
Okay. Virtual health assistants. I mean, how can the robot or the machine be your assistant, your doctor, your assistant doctor?
It can assist the doctor, and sometimes it can maybe do some of the medical tasks. Like, for example, lately we've seen the robotic surgery.
Yeah.
Okay, we just had a lecture from one of the the eminent professors who's making use of this robotic surgery here in Egypt, and he was talking about the benefits. But here we have the surgeon, the human medical doctor, making use of this robot in order to have better results for the patient. Again, it's the same idea, not trying to replace the medical doctor, but to support and help the medical doctor.
Yeah, and this is why it was called robot-assisted surgery,
Exactly.
or virtual health assistance. So yeah, again, it's always in the form of assistance. The automation of redundant healthcare tasks. Now, can this be done without assistance? I mean, automation of redundant healthcare tasks. Can the robot here in this case do this alone?
Not only the robot, but we can make use of some systems, because here we're trying to help eliminate or decrease at least the burnout that happens to many medical doctors. So we're trying to take some of the repetitive tasks that do not really need the medical doctor, and we're trying to make this medical doctor more prone and free to do the more intelligent tasks. So whenever we're talking about repetition, it's much easier to give it to a machine.
Right, right.
Okay.
So, Dr. Nevine, also one of the areas of AI in healthcare is the development of new medicines. Can you talk to us about that?
Actually, it's the discovery of new medicines, especially with the genomics. So we try to feed the system with many, again, various data, and trying to see if they can come up with new remedies, new therapies, and with the same techniques, we can measure the efficiency and effectiveness of these medicines and then make them available to patients. And that's what we saw with the coronavirus era. Because at that time, the companies were trying to come up with new medicines and treatment for this virus. And as you know that these companies had to spend time trying to measure and assess the efficiency and effectiveness of these therapies or of these medicines. But with the AI and its prediction ability, it was much easier and it was faster. And that's how they were able to come up with some new remedies and some new cures for several viruses and several diseases.
Wonderful. A question that popped up to my mind while reading about this subject is, I noticed that when there is talk about the role of AI in healthcare, there is a mention of the treatment of rare diseases, or something, that is always targeted treatment. Again, targeted, so must be somehow rare. So why is AI important when it comes to rare diseases or targeted treatment? Though the first idea that would come to anybody's mind is that treating something rare or would require high expertise and not I don't know, maybe it's hard to find something automated for this, because this is not something redundant where there is redundancy. So could you talk to us about why or how can we use AI in treating rare diseases, for instance, or in targeted treatment?
Okay, let's differentiate between rare and targeted.
Okay.
If you talk about rare diseases, then it needs some expertise. And as you just mentioned, it's not easy because it's not a repetitive or a well-known disease. And that's how we make use of artificial intelligence, because as I just explained that we're either transferring knowledge or working on large sets of analytics. So if we're transferring knowledge, then we try to come up or to deal with some experts. And with these experts, we try to extract their knowledge and to feed the system with their knowledge. And then we use this knowledge in order to identify and to treat the rare cases. We're trying to keep the knowledge safe, because otherwise, when these people are not available anymore, then we lose the expertise. And that was, by the way, the start of the artificial intelligence, the medical expert systems, trying to extract the knowledge out of medical experts and feed the system in what we call the knowledge base, and then trying to enhance this knowledge base with the new situations that the system face, and then we can treat the rare cases because we already had the knowledge needed.
The targeted treatment?
By targeted, I guess you're talking about the personalized medicine, maybe?
I guess.
Okay, so we try to get to know the patient more. So we try to gather all the details pertaining to the patient, the history, the family history, the environmental factors, and many data, and then we have a complete record. And with this record, we try using the artificial intelligence to come up with a protocol of treatment for this specific patient, using past data that was collected. That's the other way of handling or using artificial intelligence, to make use of large sets of data and then use some analytics. Again, by analytics, we're talking about deep analysis, and come up with predictions and come up with personalized treatment or protocols.
Right. Like any field or any sector, there must be pros and cons for the use of AI in healthcare. In your view, I mean, the pros could be very evident. What about the cons?
I like to say that it's not cons, but maybe you're talking about challenges of implementation more than the cons.
Okay.
So with the challenges, we have the privacy, the data privacy, especially when you talk about medical data. Who is allowed to get to know these data and why? And maybe issues related to the disclosure of data. And another point is the ethics, the ethical aspects, the regulations. What if the system takes an improper decision or comes with an improper treatment and then the patient dies? Who will be responsible? Who will be accountable for this? So we need regulations, we need to work on the ethical and legal aspects, and we need to educate the different stakeholders in the healthcare ecosystem.
Indeed. What about the economics of AI in healthcare? How has AI improved the economics of healthcare?
So it did not only improve the quality of life, but we're not talking only about the societal outcomes, but also about the economic outcomes. Because if we can go, for example, for the early detection of disease, then we'll be able to treat the disease in an early stage. And this will definitely have a better outcome regarding the economics, regarding the financial parts. If we talk about the proper diagnosis, again, we will not spend money on improper medicines or therapies. If we talk about the prognosis or the prediction of the effectiveness of a certain medicine, then we'll be reducing the readmission of patients in hospitals. And all of this has better economic outcomes. We're not talking only about better quality of life.
Sure. But is using AI in healthcare initially costly? I mean, does it have a big cost at the start? Systems that use AI in healthcare and other systems that don't use AI in healthcare, is it costlier to, or much costlier to, in the beginning? I mean, at the startup of?
Definitely, in the beginning, we're talking about a huge budget, because you're talking about IT infrastructure, you're talking about networks, you're talking about specialized software, you're talking about intelligent tools, you're talking about the data, and that's the main cost for us. How can we collect and validate proper data, not noisy data, as you mentioned at the start? So we're talking about a huge budget. Again, the human factor. We need to educate the people, the different stakeholders. So we're talking about many cost items, if we'll be using the economic terms, but that's at the start. But afterwards, it's very beneficial.
Okay, and where is the world right now from this? I mean, the advanced healthcare systems in Europe or in the West, I mean, are they all fully dependent on AI now, or use AI in a large way as in their sector?
We can say that starting with the coronavirus era, all of the world, they're making use more of AI systems. Okay,
so
because
Corona helped the AI?
Yes, it helped to pinpoint the importance and the benefits of using AI in healthcare. So nowadays we can say that we have a mix. So we still have our medical doctors, of course, and then we have the robots, and we have the robotic surgery, we have the wearables, we have the chatbots that can help answering questions, whether these questions are from the patients, from their caregivers, their parents.
But I'm not sure people will trust them. I mean, it will take, I think, a long time for people to trust
not really long
chatbot.
time, no. It's a main challenge for us. Okay, for us as AI and as IT sector. But I think that they started to trust these chatbots because that was the only solution for them during Corona. They had to have some answers related to their medical cases. So they had to deal with these systems. And these systems have proven to be very interesting, very beneficial, and their performance was very good.
But are there any statistics on whether people continue to use this form of of treatment after the end of the coronavirus or not?
They got used to this treatment, and they found out that it's much easier
and
for
cheaper.
them. It's cheaper, it's much easier, but again, with this cheaper issue, that's a challenge for us, because with the chatbots, there was a problem of who will pay for their services. Can we say that this can be a part of the health insurance, for example? That can be treated like a consultation from a medical doctor? That's a debate.
Okay. Yeah. So, I mean, how many years do you think it will take for someone like you who's specialized in AI and was an expert in AI to see AI as you wish to see in healthcare?
We're talking about Egypt or worldwide?
Both.
Maybe 1 or 2 years.
Only?
Yes.
Wow.
Because if you read about this, maybe about this topic, then you will see that people are already making use of AI systems. Even in Egypt, we're making use of the robotic surgery. We of the chatbot. We're working nowadays on the EMR, the electronic medical records. We have the digital transformation in the health insurance system in Egypt. So we already started.
Good to know. Yes. And we wish it will be only 1 or 2 years.
Hopefully.
Yes, indeed. Unfortunately, dear viewers, that's all the time we have for this episode. On behalf of you, we thank very much our dear guest here in the studio, Dr. Nevine Makram Labib, Director of the Social and Cultural Planning Center and Professor of Artificial Intelligence at Jamia Ahmad University in India. Thank you very much, Dr. Nevine. It was a great pleasure. Hope to see you again.
Thanks a lot. Thank you.
And thank you, dear viewers, for watching Business Insider. Next week, same time, is a new episode. Until then, this is Muhammad Abdurrahim, and this is a good night.